This is task 43, intravenous catheter in cephalic vein of a dog. So I've got my tray of supplies here. I have clippers and chlorhexidine and alcohol swabs, so we can put the catheter in as aseptically as possible. I've also got a sterile towel still wrapped in the drape, ready to wrap around the lower leg of the dog. Obviously got some gloves, got some tape to secure the catheter in place. I've gone ahead and already torn some strips. I've got some wide strips, and then I've got some tape that I've torn in half just to provide us with nice ways of securing the catheter. Got a catheter cap ready to go once the catheter's in. Also have some vet wrap so we can wrap the catheter and hold it in place. I have two lots of heparin saline flush. We're going to pre-flush the catheter before insertion, and then we're going to check its patency once it's in place. So I have my 20 gauge 1 inch catheter here. It's a good size for the dog that we're using today. So I'm just going to go ahead, open this up, keeping it in its protective cap packaging. I'm just going to remove the cap, and we're going to go ahead and just flush it with our heparin saline flush. This just makes sure we won't get any clots in our catheter while we're inserting it, so just making sure that the flush is coming through the needle there. And take that off, pop that to one side, go ahead and just pop that cap back in to the catheter, and we're just going to pop the protective cap back on until we're ready to insert the catheter. So I'm just going to go ahead now and take my clippers. I'm going to get my dog ready, and we're going to shave up the leg and go ahead and put that catheter in. Okay, so I have my dog here being restrained by my assistant. I'm going to go ahead and begin with shaving the area where we're going to insert the catheter. So I'm just going to have my assistant just hold the elbow forward and take hold of the leg, and we're going to go ahead and shave. I'm just feeling roughly where the position of my vein is, so I know where to start clipping the leg. We like to clip a fairly large area so we can visualise the vein, make sure that no hair is left to contaminate the site, and also if we go a little bit wide around the leg, it helps the tape stick a little bit better, and just helps secure that catheter a little bit easier as well. Okay, good girl. There you go. Alright, so I'm just going to remove the excess hair and put the clippers off to one side. I'm going to go ahead and I'm going to just pop on some gloves. And we're going to go ahead and scrub our injection site. So I've got my chlorhexidine scrubs here. We're going to do three scrubs over the site of the catheter. We're going to start in the middle like we would a surgery scrub and move on out to the outside, making sure not to go back over and contaminate the area that we've already scrubbed. I'm going to go ahead and just do the same with the alcohol wipe. And do a second scrub. Again, making sure we start on the inside and move out and away, not contaminating the catheter insertion site. Use our alcohol wipes, and then one final scrub, again just working away from the centre, and one last alcohol wipe. Okay, put those off to one side. And then before we insert the catheter, we're going to go ahead and take our sterile towel and wrap it around the distal portion of the leg. This will just prevent any contamination from the hair of the leg should we accidentally touch the catheter to that area of the leg. So I'm just going to take my towel, and we're just going to wrap that around the lower portion of the leg, and then I'm going to ask my assistant to hold off the vein just by using her thumb to occlude it, and we can see it's raised nicely there down the middle. So I'm going to go ahead and take my catheter, removing the protective packaging, making sure that the bevel is facing up. I'm just going to loosen that cap again there just to make sure we can get that off easily once the catheter's in place. I'm going to use my thumb to support the side of the vein, stop it rolling away from my needle, and we're going to go ahead and insert the catheter into that vein. And we're looking for that flash of blood, which we've got immediately there, so I'm going to then advance my catheter off of the stylet. There we go, and removing the stylet, just placing my thumb to stop the blood flow. I'm going to go ahead and take my cap and secure that in place to prevent any bleeding. I'm just going to take an alcohol swab just to wipe off that excess blood from the leg, just so we can help our tape stick and we're leaving the site nice and clean and tidy. I'm going to go ahead now and take my tape, so I'm going to just remove my gloves, making sure that leg stays nice and still. I'm going to take a thin piece of tape, we're going to go underneath the catheter, sticky side facing up. I'm going to just create a butterfly there so we can stick the tape down to the leg. I'm just going to repeat that on the other side, just quite get it stuck there. Yeah, I'm going. So that's nice and secured. I'm going to take our larger piece of tape, I'm going to go over the top of the catheter. There we go. We've got a little bit of a hairy leg here, so we're just making sure that our tape is stuck down to the underside to keep that catheter in place. I'm going to go ahead and take my heparin saline flush, and we're just going to check the patency of the catheter now it's in place. So just inserting the needle into the cap, and we're going to just draw back so we can see a little flash of blood. I'm going to go ahead and flush in that 3 ml of saline. This will just heparinized saline. This will just prevent any clots falling in the catheter, and also allows us to check that that catheter is nice and patent. I'm going to go ahead and take a gauze swab. Just going to place it over the top of the catheter, and we're going to go ahead and vet wrap that catheter in place. What we're going to do is cover the whole of the catheter, just prevents the dog from chewing on it and keeps that injection port nice and clean and away from any contamination should the dog have an accident in its cage, and it can be easily lifted to expose the port so we can give any medications through the catheter that we need to. So now we've placed our intravenous catheter, I just want to talk a little bit about catheter care and some of the problems that we can see with catheters. So some of the problems that can arise is phlebitis, which is inflammation of the vein, infection of the catheter site, and thrombosis of the vein. So when catheters are in, we need to be checking them several times a day. We're looking for swelling around the catheter site, redness, any kind of tenderness on palpation that the dog may be saw while we touch around the catheter, looking for checking that we haven't got an increase in skin temperature, which could be indicative of phlebitis and of infection. We're also looking for signs of thrombosis, so if the vein looks raised or feels cord-like, we know we have a problem. And then we're also checking the bandage around the catheter site. We want to make sure it's not too tight, so we've got no swelling around the bandage, and also we need to check and make sure the bandage is staying dry. If it's wet, we need to discover why it's wet, and then obviously change it out. Dogs and cats can be prone to trying to chew their catheters to remove them. So the ways we can prevent this, we can wrap the catheter well in vet wrap just to prevent chewing, and probably the best way of preventing
chewing of the catheter site is to place an Elizabethan collar on the dog or cat. These can either be the traditional hard plastic ones, or there are some softer material ones available on the market. Also, important part of catheter care is to flush the catheter with heparinized saline to prevent the formation of clots which may block the catheter and prevent it from working. So the recommended ratio of heparin to saline is 4 units of heparin per ml of saline.